terrorists have not placed an expiration date on their plots to destroy the American way.
We'd like to reconvene our hearing, and at this point, Mr. Souder of Indiana is recognized for 5 minutes.
Madam Speaker, I'm pleased now to recognize the chairperson of the Subcommittee of Intelligence on Homeland Security.
Something's piping through.
A veteran member of the House on Intelligence Matters, Jane Harmon, for 2.5 minutes.
Gentlelady is recognized. I thank the gentleman for yielding and commend him for his leadership.
This is clearly a need for committee assertion to have another committee hearing coming up on top of this.
Looks like judiciary is trying to assert itself.
I hope we have bipartisan agreement on the subject before us, but, Madam Speaker, I feel compelled to correct the record. Last night in his state...
Mr. Souder.
Thank you, Mr. Chairman. And I actually have two subjects I want to touch on, and I hope I'll have additional time. Let me just point out for the record, so there's no question, in Elkhart County is approximately 58% of the trailers made in America, and Joe Donnelly and I represent that district. I first wanted to briefly make a couple of comments about FEMA disaster declaration that failed to occur in my district. Mr. Castillo and I had a long conversation. I know I was a bit testy. I appreciate him putting up with that, but I feel very defensive for the people in my district, and I briefly want to read into the record. The town of Napanee had approximately 10% of its town destroyed in a tornado and were twice denied by FEMA aid. This type of letter, which actually comes from a resident in a nearby bigger city, says Napanee residents are proud, hardworking, self-sufficient, and God-fearing people who have not spent their lives learning to solicit government funding. Besides that, there is not enough votes in Napanee to interest those people who give out such freebies. Nothing new here, just 21st century America. The challenge that we have is that in FEMA's denial to this small town, it was stated that they had sufficient resources. The fact is that the town they cleaned up immediately $942,000 in expenses in a town of 5,000, of which they had $469,000 covered by insurance. The FEMA in our discussion is that the state should pick this up. The state had never done this before. It was kind of a new challenge, but they put in $198,000, which left the town with $285,000. The community residents came together and have raised, but this has nothing to do with actually low-income people who lost their homes or who don't have services. That left the city short about $300,000 in this small town, plus the people not served. But the town people came together in the region and raised $600,000. Now, had they sat back, in the FEMA denial, it said that they had sufficient resources. This is a below-average income town. That they have sufficient resources because they gave themselves and they insured themselves. And I want to talk further at another point about how we deal with small towns. 10% of the homes were destroyed. In Southern California, between Santa Barbara, Los Angeles, and California, the statistics that you gave me and were in the news, that you had 3,000 homes compared to 300 destroyed in an area with possibly 15 million people that certainly had far more resources to take care of it than the people of Indiana or that community. And that somehow we have, in our policy, I believe, built in a prejudice that makes it very hard for small towns to meet FEMA emergency standards, particularly small towns that are aggressive and don't wait around for the government to come in a couple days later and make assessments. And it's a policy question in addition to I'm just outraged at what happened to this town. And it's spread to Fort Wayne, to South Bend, because nobody understands, and they all have had FEMA declaration questions. We have lots of flooding in Indiana. We have occasional tornadoes. And it is a huge challenge. And while it's not the subject of today's hearing, it's indirectly related. Then, ironically, this same town that has been hammered by the tornado, that had a downtown fire 2 weekends ago that's arson, is the #1 manufacturer of the trailers that went to FEMA for Katrina. And that I've basically, I sat through the government reform hearings. Quite frankly, they were extraordinary entertainment, but I was totally unimpressed with the science. It was all hoopla, all hat and no cowboy, so to speak, and that there wasn't any science. The fact is, and I would like to insert into the record, Mr. Chairman, a article from Florida in the Palm Coast, if I'm asked consent to do so.
Without objection.
That Representative Alice Hastings says that he's concerned that this investigation is slowing down the potential to respond in Florida. Out of 20,000 of these trailers that went there, there was one complaint. The housing standard that was put into these trailers was HUD standard, 0.04 formaldehyde. That in the study, it has to go beyond just what happened in Katrina and Mississippi, because there may be localized effects, but we've been assassinating an industry here in a question of whether formaldehyde can be used. Formaldehyde is actually in your body. You would die without formaldehyde. That when we get into these kind of debates, it's like formaldehyde is always wrong. We want to make sure people don't get sick in housing. We all share that. We also want to make sure that housing is affordable, that it can get there in emergencies, and it is a tough balance. We have a 0.04. They're trying to look how to build to the California standard, which is a little higher. But to say it has to be a zero tolerance is nonsensical, quite frankly, and that we have to look at a broader question here beyond just Katrina. Why aren't the statistics coming in from Florida? Congressman Dix raised this has been a long battle. Is it a long battle in regular housing? Formaldehyde's in regular housing. They're meeting the HUD standards for regular housing in these particular trailers that were made. So why aren't the employees at the companies getting sick? Somewhere around 1 in 10 people in America have been in these trailers and either own them or have leased them in America. We don't have these kind of reports. Now, there's a question of length of time. Well, if there's a length of time and ventilation, that ought to be looked at beyond just what happened in Katrina here before an entire industry gets changed, because quite frankly, many seniors travel around in these trailers all over the country, and there's no evidence that this is the question is, bluntly put, is has this been whipped up? Because the people that we had in front of us at government reform had multiple possible explanations beyond just the trailers. It also could be that the season, the dampness, there was something else that interacted that wasn't fundamental to the percent formaldehyde in a normal trailer that was aggravated in those situations. And I would urge you to be very careful about the science here, because thousands and thousands of people's jobs are dependent. Affordable housing is dependent. If you make these up, quite frankly, there are people who would like to make this type of housing more higher priced so that they can compete. And whenever you make these kind of changes, and also the question is how else are you going to do this? How are you going to help people who are in an emergency who don't have something? Now, certainly, there are legitimate questions about whether or not people were kept in them too long and all those kind of questions. But I urge you in the Center for Disease Control to make sure that this is precise, because it affects multiple categories: employees, people who live in it, emergency handling, and affordable housing. Thank you, Mr. Chairman.
Thank you very much. And I don't think we need a response to that. The gentleman will obviously have additional time for questions. We now recognize the gentleman from Texas for 5 minutes, Mr. Green.
Thank you, Mr. Chairman. And I thank the witnesses for testifying today. Let me start with Mr. Falk. Mr. Falk, sir, you indicated that there was a narrow question posed. Is that correct? Is this correct?
Yeah, I pointed out initially that was the case. In the current effort, we are actually doing a number of
but you also indicated that because the question was narrow, the answer was designed to accommodate the question.
I think the answer was designed to answer the question as they saw it.
Yes, sir. Well, is this one of those questions where a person knew or should have known that by asking a narrow question you would get a narrow answer?
I think the way I would phrase it in terms of the ATSDR folks, they're used to getting a number of very specific questions about mitigation efforts, a specific practice, for example, after Hurricane Katrina related to debris, or what a specific set of levels of chemicals in soil might mean. I think the people who dealt with this dealt with this problem as they have been dealing with problems, and so they focused very specifically on the question at hand.
And by focusing on the specific question at hand, they overlooked an entire universe of additional knowledge that would have been beneficial?
I think I would agree with you. I think the earlier one would have introduced that broad discussion about the potential for long-term effects. Maybe that would have advanced. I can't disagree with you on that. That did come up for very full discussion when Admiral Paulson wrote to Dr. Gerberding.
Now, let's talk about the person who received the question. Should that person, having received a question regarding what is a potential health hazard, should that person have known that this would necessitate a broader answer than the one that was accorded?
I think they were focused on an issue that in their mind was unoccupied trailers. They saw this as a very specific question about practices and how that related to formaldehyde levels generically in trailers. I think they were very focused on the specific mitigation efforts like the use of air conditioning and different ways of ventilating the trailers. I think they were trying to respond very specifically to those questions, and that's how they construed the issue to them.
If I may, Doctor, how did they conclude that this was unoccupied, the trailer was unoccupied?
No, the data that was given in that original ATSDR health consult was very clearly from 96 unoccupied trailers. The formaldehyde levels had been collected in those trailers by EPA. The data was then transferred from FEMA to ATSDR. Can you look at this data? It was very clearly identified as levels in unoccupied trailers. And they had looked at it over multiple days in different circumstances.
The recipient of the letter knew that the response was going to be one that would relate to persons who were living in trailers that were occupied. Is this correct?
I'm sure they had to have some sense that this kind of information would have been helpful to anybody wanting to address issues in occupied trailers.
Yes, sir. Gentlemen, what purpose would getting this information for an unoccupied trailer, how would that help in this situation?
Well, if, for example, one looks at the data in that original consult, the issue was, does turning the air conditioning on lower the formaldehyde levels? And the other item that was tested was whether ventilation, opening windows, vents, and so on, does that. And there actually was a there was a real difference. The air conditioning did not lower the levels nearly as much as the opening of windows and the vents. So that's kind of useful information to know in terms of what kinds of practices actually change the formaldehyde levels. So that's the short-term answer. And I think that's for any term. The question was, will it lower, formaldehyde levels? The issue in terms of long-term is, can it lower levels sufficiently to be fully protective of long-term effects? And this consult noted it didn't actually speak to that. It spoke to the fact that they thought that the ventilation lowered the levels to a kind of a level that is related to acute effects, and people have been sensitized. They said they weren't addressing the long-term impact. Who said they weren't addressing the long-term impact? People who wrote it. They said they weren't trying to establish a safe level of trailer. Just for the record, who are these people, so we'll be clear? These are the individuals at ATSDR who wrote that consult. At CDC? Well, ATSDR is a very related agency to CDC. Well, I mean, we want to make sure the record's complete. It's the ATSDR health consultation, exactly. I've taken the gentleman's time, but I think the question is from CDC's standpoint, if you know there are potential health hazards for people who live in the trailers, is it not, from your perspective, the right thing to do is to tell FEMA, even though you didn't ask us,
we want to make sure you are aware of the long-term health consequences of people living in trailers based on our review.
I think you're absolutely correct, and I think that was the reason that other senior scientists tried to correct that in letters to FEMA to identify that the issue of whether these were fully protective of long-term effects had not been addressed in that document. That's why it was reissued and tried to actually say that more explicitly.
So I guess the question now is FEMA in custody of this information?
Well, there were two letters that were forwarded, one in late February and one, I believe, on March 17th.
So it's, to your recollection, FEMA is in possession of these letters?
They would have been sent, yes.
Mr. Castillo, are you aware of these letters?
Yes, sir. And again, what the letters and what Dr. Falk is saying having to do with whether there is any long-term effects, we're aware of that. You know, and when this came to our attention, as I said earlier, when it came to our attention following the trends that were noticed, we realized that this was an issue that needed to be addressed. That's when we began to take action. So we don't question whether there is a long-term or a short-term effect. We understand, we've been told that there is a potential harmful effects from being in formaldehyde, especially to people who are sensitive to it. So that we don't question that. And once we realized that, we began with a 24/7 call center for people who had concerns. And the vast majority had questions that were referred to CDC, but the people who had concerns about being in the trailer were offered immediately either hotel, motel in the immediate, or given other options so they can move out.
So how did you notify the people living in the trailers?
We've went out, hand-delivered flyers. There's been new media announcements.
To every trailer?
Yes, sir, in the Gulf Coast. Through our Gulf Coast, through our transitional recovery offices that we have in every state, have went out to every trailer and handed out flyers, have posted them, have announcements I believe television, but I know radio, that this is the process and these are the numbers to call. Now, these folks know the number to call because that's the number they call to get involved.
Thank you.
Yeah.
If we had a disaster tomorrow, would we have people in these same trailers?
The people who are in there now?
No, obviously not the people in there now. If we go to Ohio with a disaster.
Well, sir, the trailers, travel trailers, first of all, and the direction from Secretary Chertoff and Administrator Paulison is that we will not use travel trailers.
What will we use?
And
I'm just trying to...
The housing, I'm sorry.
I mean, I'm just trying to get to the point is, if we have a problem with the trailers, and FEMA's charged with temporary housing, shifting it to HUD at some point, what's the temporary housing plan if you have deemed travel trailers to be insufficient given the health consequences?
That's correct. And in any case, travel trailers were a last resort. We would look to place people in temporary housing in apartments that may be available, and depending on the magnitude, that may be available locally, maybe a little further away. But the point is, we look to place them in temporary housing, meaning working towards more permanent solutions, but apartments.
Thank you. Gentleman from Indiana, would you like to?
Mr. Chairman, if I
Sorry, you're back.
Thank you. Sir, Mr. Castillo, were there children in these trailers?
Yes, sir.
And were these children in these trailers for months, some of them?
We're talking about the trailers that are currently in the Gulf Coast?
The trailers with the formaldehyde?
With families, yes.
Okay. And have the children been examined so as to ascertain whether or not there has been some adverse impact on the children?
So I don't know. I don't know the answer to that. And
we do not have a program in place to assist persons who have been in the trailers? A program, a health, not a notice, not just a simple document saying you have been in this circumstance, but are we actually taking affirmative action to examine people, especially children?
Yes, sir, and I'll defer to my colleague from CDC, but there is the helpline that families can call if they have concerns that are then given
Well, I understand.
direct information.
I understand,
So-
but sometimes people don't always call as promptly as they should. So, Doctor, would you care to
Yes,
please
so
explain?
maybe let me mention several things. First, that is a very important issue, children. We recognize that it is a real concern, and very much be cognizant of that. One of the things we have
Doctor, I'm going to have to interrupt because my time is almost up. So please now, I'm not trying to be rude, crude, and unrefined. Doctor, listen,
Yep.
Do we have a program that involves the examination of children who were in these trailers?
We have
A program.
There are two efforts underway. One is to evaluate what happened to children in
What does
Mississippi.
underway mean? Is that something you thought of just now, or is it something that has been codified that is ongoing?
No, this is something. One is ongoing, and one is being planned.
How many children have been examined?
We are currently, the effort is underway. We are.
How many?
We are actually reviewing the records of
How many children have been
several
examined?
hundred. We are reviewing the records of several hundred children who were treated by physicians in Hancock County, Mississippi, to evaluate those records. And
Were those children taken to the physician specifically because of the conditions in the trailers?
yes,
So you have several hundred children who have been examined?
they've been examined in Mississippi, and we are reviewing the records to review the health effects that have been reported and to try to analyze that. And that is well underway, and we hope to be able to report on that, I believe, in the coming month or two.
Doctor, it seems to me that this would be a circumstance that would necessitate immediate action, if not sooner. And to say that we are looking at records from children who were examined at some earlier time, it seems that we're not acting expeditiously, not to my satisfaction, given that we have children who have suffered under these conditions. Why is it taking so long?
We also have worked on developing a protocol to look at a much larger number of children, which hopefully can be underway in the near future. And that's designed to actually look at these children over time for a period maybe of up to 5 years to ascertain whether there were impacts from having been exposed or sensitized. So, and that's a protocol that's being developed and hopefully will be underway in the near future.
Why is that protocol not in place? This is not something that happened within the last month. Does it take this amount of time to develop a protocol?
A study protocol, yes, because you want to be able to analyze that and be able to provide, good information.
Thank you, Mr. Chairman. I'll wait for the second round.
Thank you. Gentleman from Indiana.
I appreciate the chairman's indulgence. We clearly have two things occurring here, and I'm worried that they're overlapping. One is that serving the people in Katrina, who clearly have felt there's been inappropriate response, certainly from the early days on, and it's gotten involved in a very contentious question and needs to be an urgent question related to the government. But then I was very disturbed to hear that based on assertions and lawsuits, not facts at this point on Katrina, that you're going to ban travel trailers from everybody else, when in fact no evidence exists of similar phenomena in Florida, where 20,000, one case. These things are used all over the United States, and I would also, I'd like a comment about that, because I mentioned that earlier, Dr. Falk, but then Mr. Bergeron, my understanding is, the trailers were built to .4. That's the HUD standard. Does this mean, what does this precisely mean? Does it mean you have formaldehyde in so-called site-built, stick-built, recreational vehicles? Isn't formaldehyde fairly common in homes, and isn't there a standard?
The Department of Housing and Urban Development's Office of Housing has a division which is the insured housing. We have an office that insures prefabricated homes. So what we're talking about when we talk about trailers and prefabricated homes or modular homes, they're two different things. So we do test for materials that are used in the construction of modular homes or prefabricated homes. But we do not test trailers are the ones that are being used by FEMA. Our studies indicate that the materials that are used in the modular homes that the Department of Housing and Urban Development regulates as part of its insurance programs, you are correct, sir. What we're looking at is 0.04.
And in 0.04, Dr. Falk, when you look at that, are you looking at variations? Because an isolated study in Katrina is one thing, but it's not like this is unknown or an unknown quantity in housing.
One of the studies that was addressed in my written testimony, and we'll be happy to provide additional information on that, is that in addition to the occupied trailers, we have several investigations underway to evaluate unoccupied trailers and understand as best we can where the formaldehyde comes from and what potential ways there are to mitigate that, and understand where the source is, and could that be done without the, so for example, we were looking at formaldehyde levels under different conditions in the unoccupied trailers. We are taking apart a significant number of such trailers, looking at all the furnishings and trying to identify what are the specific loci for the release of formaldehyde. And we will also be working, planning to do this with NASA to look at some specific mitigation techniques that could actually address whether you could actually lower those formaldehyde levels in the trailer. So we're trying to look in a very thorough way as to whether there are specific aspects of the construction of the trailer that contribute to the formaldehyde, and is there a way of mitigating that? And that's separate from the study of the occupied trailers. And I believe the recreational vehicle industry is aware of these. They have commented on those study protocols. And so we are trying to actually pinpoint, see whether there are specific issues that could be addressed that would actually...
Why do you believe this question never came up in an extensive way before Katrina?
I think Katrina, in my mind, in my times at CDC, and I'm not a housing expert, but you know, I was in Louisiana after Katrina, approximately 1 week later. The numbers of individuals displaced, the numbers of housing units that were needed are just so much larger, I think, than in previous
But wouldn't you have
episodes.
seen statistical anomalies with 20,000 in Florida? I mean, it's not like we haven't done thousands, tens of thousands of these and not noticed statistical anomalies.
Right, and I think in terms of the questions that have been raised about long-term effects, you would notice the short-term effects. People would have nasal irritation, eye irritation, coughing, exacerbation of asthma. You would not notice if there was a potential for long-term effects, say cancer in the long term, you would not be seeing anything. The issue is whether one can bring the formaldehyde levels down to the point where people are not concerned about the long-term effects. And so that's what we're actually trying to see, whether you can actually study the problem over the next several months and identify the source of formaldehyde, and if there's something remediable about that or fixable about that.
Thank you. Mr. Chairman, thank you. I do want to point out that what we're talking about mostly in Katrina are short-term effects. They're also looking at long-term effects, which would affect the study length, too. But the Katrina stories that we heard over in government reform and the cases that were out were mostly short-term because they wouldn't know long-term yet.
Thank you very much. Young lady from the Virgin Islands for 5 minutes.
Thank you, Mr. Chairman. My colleague, our colleague, Sheila Jackson-Lee, has to leave for a meeting, so if it's all right with you, I'd switch my time with her.
Young lady yields the time to the young lady from Texas.
But I'll be able to reclaim her time when...
Yeah, which
Thank
is
you.
a little further down.
Got it.
All right, thank you.
Mr. Chairman, let me thank you very much, and I'd like to answer a number of the points that my good friend from Indiana has made. I want to thank the chairman for what I consider to be an enormously important hearing, and to try to focus on the crux of why we are where we are. There is long-term damage on this question of formaldehyde because we have a situation where individuals are in trailers for now more than 3 years, and that is the plight that we find ourselves in. I know that this has been offered into the record, but I do want to acknowledge Dr. Christopher DeRoss, who, it looks like it's Dr. DeRosa, who offered his concern February 27th about the formaldehyde situation and the lack of action by CDC. I think he's a whistleblower, and I want to acknowledge that. Mr. Chairman, I'd also like to hope that we'll be able to view the video, the news video that really framed the crux of why we are here. The problem that we have is that the idea that Congress had to solve quick response to disaster housing is a complete failure. And HUD and FEMA are wrapped around this failure, except for the fact that I will acknowledge that HUD, the language, waived all of its rules, and I understand that, and I appreciate it, but it obviously disconnected to the states, in particular, if I might, Texas and Mississippi. Mr. Gerber, let me thank you and all of your hard workers. I understand that you were implementing this program through your leadership in the state, but the state of Texas has failed, plain and simple. And I want to put on the record, and I'm sorry that the governor is not here, because he made these determinations to have us in a situation where we had $428 million that was rendered to Texas, 210 in Southeast Texas, 60 million in Houston, 42 critical infrastructure, $21 million to be used for administration, and we spent $1 million. So let me go to Mr. Castillo and Mr. Burgon. You are the holders of this failure, because Congress came and said, how do we help these people in the immediacy of their dilemma and their crisis? This is the face of people living in trailers now since 2005 who are not getting out of these trailers anytime soon. Why? Because where is the oversight by the administration on the governor of Texas? The governor of Mississippi is now using his monies for infrastructure building, so people are left homeless again. The reason why formaldehyde is an issue is because you have them in these trailers for longer than 6 months, 7 months, 8 months. When Texas took the freedom of saying they will use the COGS as opposed to direct compensation, why were there not benchmarks that you begin to ask the governors, what are you doing with the money? Why hasn't the money been spent? Mr. Castillo, is this working? What can we do better to ensure that we do not have the collapse that we have now between the federal government and the state? And Mr. Burgon, I'd like you to answer as well. Formaldehyde is cancerous, and this is the face of a person living in a cancerous condition, and there's no dispute of that. Mr. Castillo?
Congresswoman, I want to tell you from FEMA's perspective, we're doing everything we can to get people out of travel trailers and out of mobile homes into more permanent housing. I believe what you were referring to has to do with the CDBG funds that are used, and that's not something within our...
Mr. Castillo, don't push the buck. We formulated this process to move you and HUD together so that there could be a transition. Right. So my question is, what relationship do you have to HUD? You got these trailers there.
Yes.
It doesn't mean because we created a pathway that you were supposed to drop the ball. Did you assess what was happening to people that were in your trailers as to whether or not they got out of your trailers after the money was distributed, after you transitioned to Mr. Burgon? Don't you think you had a responsibility, since these are FEMA trailers, to wonder where people are, or whether or not you need to go move the trailer off the land because people are out of the trailers?
The number of people that were transferred to HUD under the DHAP program were approximately 28,000 households.
And did they live in trailers?
Not all, no.
Some did. Some are in your trailers.
Yes, but what the trailer, as we move people out into trailers, they ideally, and I believe there will be about 8,000 more families that will transition from trailers, usually going from trailer to an apartment.
I understand that. Do you have people living in trailers in Southeast Texas? To your knowledge, the trailers that you put on the ground, are they your FEMA trailers?
Yes, they were purchased.
Mr. Burgon, that's the question, Mr. Castillo. You still have people living in a trailer. We created this seam. The seam didn't work. My question is, why isn't FEMA, DHS, connecting to ask why are people still in trailers based upon the instructions of Congress? Mr. Burgon, again, people are in trailers in Southeast Texas with a $428 million disbursement to the state of Texas. Where is the accountability in HUD, and why are these people in trailers that are subject to formaldehyde?
Thank you for your question, Congresswoman Jackson Lee. There's two different things that we're talking about here. We're talking about the Supplemental Community Development Block Grant, which the state of Texas received under the first appropriation, supplemental appropriation, about $75 million, and the second supplemental appropriation, which the state received roughly about $423 million.
HUD dollars.
That is correct. That money is the money that Mr. Gerber's agency is working with for the homeowners rehabilitation program. The trailers, the disaster housing assistance demonstration program is a separate program. That is a demonstration program in which FEMA came to HUD and said, HUD, you have an infrastructure of public housing authorities and partners in the private sector that can provide, identify...
If I may, Mr. Bergone,
yes,
you have people in trailers in southeast Texas with federal HUD funds.
No,
the question is, let me finish. Yes. The question is, where is HUD's oversight for the utilization of those funds? My understanding is that there are people in southeast Texas who are victims of Hurricane Rita. They're in FEMA trailers. FEMA transitioned to HUD because of Congress wanted to quickly get someone who understood housing. The simple question I ask you, why are people still in trailers
the agreement
as of 2008?
Yes, madam. The agreement that we have with FEMA is that it's FEMA's responsibilities to get those families and individuals out of the trailers, and then HUD takes over. So HUD is not in the business of relocating or finding people homes or units that live in trailers. That is FEMA's responsibility.
Didn't you give money to the state of Texas to be able to help these people's houses be rehabilitated? Then yes, why are they still in the trailers in 2008? Did you have oversight over Texas and the governor of the state of Texas, Governor Perry, to ask why the monies have not been expended?
Yes, ma'am.
And what was their answer? What was Governor Perry's answer?
We have decided to run a rehabilitation program that takes a little longer than a compensation program.
And that's the question. Shouldn't you have had concern that we now have individuals in trailers in 2008 and there is no movement, and I don't know whether or not it's a staffing issue, but no movement on the basis of the crisis that the federal government perceived. We perceived a crisis. We said, how do we make it work? FEMA and HUD get together, and you relied upon the state, which is obviously not concerned about the urgency of now. The governor of the state of Texas, the governor of the state of Mississippi is using his for infrastructure work and parties and whatever else can go on. But the question is, what is happening to the people who are still in trailers?
Now, the state of Texas has moved forward with the first supplemental of the $75 million. We show that they have disbursed about $13 million, not the $1 million that I heard before. And on the second supplemental, my understanding is that there's a lot of cases in the pipeline that they will be processing shortly. And perhaps Mr. Gerber can give you a better update as to where they are. But madam, you are correct. There are people still residing in trailers that should not be residing in trailers. HUD's mission is to work with the state to make sure that homeowners or renters that are living in trailers will move to safe, sanitary, decent homes. And we're working with the state on that. As it relates to the DHAP and FEMA, we need FEMA to work with us and get those folks out of trailers, and then we will find units that are safe, decent, and sanitary under the HUD programs to ascertain that we're not moving these people from a trailer and putting them in a housing condition that perhaps could be worse than a trailer. So we're doing our due diligence and making sure that the landlords that participate of our DHAP programs have units that are decent, safe, and sanitary.
I thank the chairman.
Thank you very much. And Madam Chairman Lady, we will follow up with some more questions that have been raised along this issue.
I'll be back for the after.
Gentleman from North Carolina, Mr. Etheridge.
Thank you, Mr. Chairman. Let me thank you for holding this hearing. Let me ask each of you just a yes or no, because I think some of us represent areas that produce prefabs, modular homes, some call trailers. You're talking about travel trailers. Mr. Cadill, correct?
Yes, sir.
Yes.
Travel trailers. I want to make sure that's a part of the record, because I think we sort of use that interchangeable, and I think it's unfair to an industry if you don't get that on the record, Mr. Chairman. I think that's important. Thank you. Mr. Castillo, let me ask you a question. North Carolina, the state that I happen to represent, sort of known as a state that's has for years been in the bullseye of major disasters from hurricanes. Unfortunately, through his route the last several years, and some of our folks are even making the analogy we'd like to have one just to get the water. That's not the point I want to make today. My point is this, that should one strike our state, I'm certain that our state responders, our local responders, they're ready to respond. They've practiced, they're ready, they've done a good job. They've had a lot of practice, unfortunately. But based on the challenges following Hurricane Katrina and others, and what I'm hearing today, I'm not totally convinced that FEMA's ready. My question to you is that this whole issue of a major hit puts tremendous pressure on housing. And you now have entered into an alternative housing pilot program. Can you share with this committee and with me what are you learning from this? What solutions have you found? And will you be able to apply those should a major disaster hit? Is that now prepared? What have you learned?
Yes,
Very
sir.
quickly, so I can get to my other questions.
Yes, sir. And I appreciate your comment on representing a state that is in the bullseye, because I come from Florida, and perhaps as much as North Carolina, if not more. The two things: the one, the alternative housing pilot program that I talked about earlier in my opening statement. The 4 states that have competed for and received funds that are building units that will hopefully be used in the future to replace travel trailers.
Yeah. What have you learned?
And, well, that's in the process. I mean, they're
When will they be ready?
being evaluated. They're being evaluated over the next few months. We've also got the Joint Housing Solutions Group that is looking at a lot of other options as well.
I'm sorry, but I don't have a lot of time. What's the timeline?
Joint Housing Solutions Group probably within the next few months will move to the next step of going and actually.
When will they be ready?
Sir, it's impossible. I don't know the answer.
Can we get that information back?
Yes, I will. I will get that.
Thank you. I don't want to mean to cut you off, but I want to get some other questions and try to. Let me follow up with one additional question. In July of 2006, FEMA produced a job hazard analysis that warned FEMA employees of the potential injuries associated with travel trailers. The analysis said cancer was a concern and required FEMA employees to undergo formaldehyde awareness training. If FEMA knew that there was health risks associated with the use of travel trailers, why were they deployed, and why were the vulnerable, displaced disaster victims not warned of the risk? During 2006, what efforts did FEMA undertake to protect the health of travel trailer occupants? I mean, that was 2 years ago now.
Sir, and I'm not familiar with the analysis that you mentioned, but when we became aware that it was a problem was when, I believe in May of 2007, when there was the trend reported by the pediatrician that I spoke of earlier, and the next day we employed the Office of Health Affairs of the DHS.
All right, I don't mean to cut you off because I want to get one more question. I'm running out of time. Let me ask you to do this. Go back and look at the record. And if you would submit that in writing, that would be grateful. Pull the 06 material and submit that in writing, that'd be great.
If the gentleman will yield, we had asked for a timeline similar to what you're asking that would reflect that information also for the committee.
Thank you, Mr. Chairman. Dr. Falk, as you mentioned, the CDC has identified health risks associated with travel trailers. Do you believe the travel trailer occupants have a right to know about any and all potential health concerns? Number 2, do you think you should inform the occupants? We've talked about that already today. It bothers me as others have, and I think it's a concern because we're really talking about children and others in it. What would you like to say to them today? I'd like to give you an opportunity in just the next minute to, what do you like to say to them about where we are and what we're going to move to do to try to mitigate this problem?
We have a very active program currently to provide information to occupants of trailers. One of the things that I have said on a number of occasions, is that the issue of children is very important. And even though the formaldehyde level, a single formaldehyde level, is helpful in understanding the risk, there are other issues that are much more that can be much more important, such as whether children are in the trailers, elderly on the trailers, people with chronic diseases are in the trailers, people with asthma, that one really has to pay attention to the need for alternative housing when there are high risk or vulnerable individuals in a trailer. So we actually highlight that in the information we provide.
Mr. Chairman, thank you for, let me just make 30 seconds, if you will. I know you've indulged me so far. We had a substantial flood in North Carolina in '99. FEMA came in. We had travel trailers. I really hope we can get the information because some of these people may have been affected. But to the credit of FEMA at that time, they moved for mitigation. And we really helped people move into permanent housing. I recognize it was not at the level, nor was the magnitude of it as big as FEMA and Rita. But the Rocky Mount project is a model for the country now. And we really ought to look at some of the models that have been successful, where we did move some people out. I don't know how long some went in trailers or whether or not there's any lasting effect from some of those. I hope we would go back and take a look at those if we've had people exposed for long periods of time. I think that'd be appropriate. Thank you.
I have a parliamentary inquiry.
Sure. Gentleman from Indiana.
I agree with Mr. Etheridge's question of why would FEMA employees be treated differently than the poor, and I would like to supplement his question, which was on what grounds did FEMA make that memorandum to their employees? Were there any facts?
Whether or not it's been circulated at all.
Yeah, well, one would be is, yes, if they circulate it, whether they had it with their FEMA employees, why would they give it to them and not to the poor? But on the other hand, what made them make the decision in the first place? Because part of my question is did they have any facts when they distributed it to the FEMA employees? Certainly we shouldn't have a double standard.
Sure. Are you aware of the gentleman from North Carolina's reference to this standard for FEMA employees?
No, sir. As I mentioned, I'm not aware of the memo that mentions the analysis, Mr. Etheridge.
Well, we'll have staff provide you with
Yes.
the reference memo for your response.
Yes,
I'd also like to say that part of this hearing was due to a CNN story that ran on Texas, and that Ms. Helen Saunders, Mr. Gerber, who I know you're intricately familiar with, and my understanding is you will be, someone from your shop will be interviewing Ms. Sanders tomorrow?
Mr. Chairman, we have met many times with Ms. Sanders, and she is someone who lives in a very small community of Sabine Pass, which is really out on kind of it's not a barrier island, but it sort of juts out in the Gulf of Mexico. It was where the storm came in. That town had waves of 10, 12 feet in that community. There is, as the second pot of money, there are funds that are devoted exclusively to the redevelopment and repair of homes in Sabine Pass. And Ms. Saunders is one of those families. She's living in a trailer, and certainly there are lots of other folks in Sabine Pass that we're concerned about as well. The challenge in that part of Texas is that you're going to have to go and elevate those homes 14 feet, and there are many seniors who live there as well, who've chosen it as a retirement community. There are many who've lived there for many years and have accessibility issues, and so there's additional funds that are available to build accessibility features for those homes as well. I think and the reason those funds were devoted to Sabine Pass is, and I'm sorry Ms. Jackson-Lee's not here to hear this, is that we worked very closely with locals to identify how those dollars should be used. I think the governor showed tremendous leadership by working with local elected officials to ask them, how do you see the use of these funds having the greatest amount of impact? And what they told us over and over again was they wanted us to get a start, understanding that there wasn't going to be sufficient funds in order to do the kind of rehabilitation and repair and all that's being done in the other states.
But I'm sure you can understand the impatience of individuals who have been told help's on the way and being put off and put off. And part of what we're trying to do is establish some parameters so that citizens of this country who we have to help can have some general understanding as to when and how the help will come. And I guess part of the question for me would be, has HUD established or FEMA established a reasonable timetable by which they'd like to move people from temporary housing to a more permanent housing, and has there been some memo of understanding or agreement executed between the parties to that effect?
Sir, on FEMA's point, we have a date of May of 2008 to move everybody out in the Gulf Coast, of knowing that we're moving 1,000 families, 1,000 households a week, and that's our goal. That the administrator wants to have people out of travel trailers and mobile homes prior to the hurricane season.
So that is just for this specific instance, but is there a policy that you framework that you try to operate from, relative to from transitional housing to permanent?
Well, we try to make that as short as possible. And putting Katrina and Rita aside for just a second, in the past, maybe 2 to 3 months was the average that people would stay in a travel trailer or mobile home. You know, this has been a different story, obviously, because of the magnitude and scope of this disaster, especially Katrina. So our point, travel trailers and even mobile homes, manufactured housing is the last resort.
Well, see, I would accept that if I could see the 200% effort being put forth to address many individuals who are still in temporary housing. My state, for instance, decided that $600 million of this housing money ought to go to a port facility rather than to the neediest of the people. And so it tells me that 2.5 years after Katrina, either we gave too much money to start with, or the standard by which we have used to get people in housing is so high that we're just not doing our job. And you have to be there to see the people who are still anxiously awaiting housing, and it's not taking place. So I'm trying to get a picture of a 2.5-year lapse of time. Congress being more than generous in giving money, but yet help is not on the way. And in the middle of this help, states decide to do other things with the money. And that, for me, from HUD perspective, to approve it, when I can take you to Mississippi and show you a number of families who are still needy, who, because of this diversion, will have to wait longer. But yet and still we approve it. And I'm real concerned about that, because our resilience as a nation is based on our ability to help our citizens. And for this 2.5-year period, we have not done so. And I think that's part of the reason we're holding this hearing. Mr. Tipson, can you tell me whether or not the housing needs associated with this hurricane has been met satisfactorily, or there are still some other outstanding issues?
The housing needs in Mississippi absolutely have not been met. The $600 million diversion of funds from a housing program to an economic development project for the Port of Gulfport was inappropriate. It is not the position of the Lawyers Committee that HUD had no discretion to approve that plan. In fact, 50% of the CDBG funds were supposed to benefit low and moderate income people unless the state could show compelling need. And to my knowledge, that need was never demonstrated by anyone in Mississippi and never evaluated by HUD. So I think that your concerns are absolutely justified. There certainly is a great need for the construction of more affordable housing, and many of the people who are in travel trailers today are not able to move into rental units because there simply is no affordable housing. There's nowhere for them to go.
Mr. Burgon, can you share with me HUD's justification
Absolutely,
for
Mr. Chairman.
approving this?
Absolutely. First of all, the state of Mississippi received in its first supplemental appropriation about $5 billion. The second supplemental appropriation, they received roughly about $423 million. The state originally budgeted $3 billion for housing. The state came to the Department of Housing and Urban Development and submitted an amendment to the original plan requesting that $600 million be reprogrammed from housing activities for an economic development project in the port. HUD looked at it. The original supplemental appropriation told HUD's secretary that he could waive the 70% low mod requirement, which is the CDBG requirement, down to 50% if the states asked. The 5 Gulf states asked that the 70% be waived down to a 50%, which is what the statute allowed. Furthermore, the law reads that if there is compelling need, the secretary may reduce, or originally shall reduce, less than 50%. Mississippi has never been given the authority to do less than 50% as an economic development activity.
I understand, and we have some other members, but I think that the point that I'm trying to make is whether or not the unmet housing needs of Mississippi have been met with this HUD money, or have we diverted monies intended for housing to address that unmet need to another function?
According to the state, Mr. Chairman, the $3 billion they budgeted was an overestimate, and that they could meet all the housing needs in Mississippi with $600 million less. So the state has made that determination.
I understand. But now, has HUD made a determination as to whether or not the state is correct?
The HUD has told the state that we're very concerned with the provision of affordable and decent housing in the state of Mississippi. And as a result, the secretary met with Governor Barber, and there was an agreement that they would put in $100 million more into affordable housing than was before the workforce housing.
$100 million of state money or federal money?
No, federal money, sir.
So we just shifted money around?
Well, what the state was saying was we can do what we need to do as it relates to housing with $600 million less. The secretary said, we're not too sure about that, so you have to leave at least $100 million more and prove to us that, in fact, you are meeting the housing needs. And the state has certified to us that the monies that have been budgeted but not expended, sir, so there's a difference between the state budgeting money or obligating money and expending money. So the state is spending money, but perhaps not to the rate that we would all like to see in order to...
So you agree that the housing needs at present have not been fully met?
The Department of Housing and Urban Development is very concerned about the progress not only in Texas and Mississippi, but Louisiana as well. We're very concerned, and we're working with the states. We're giving them all the technical assistance necessary. We're ascertaining that the monies are being used properly and efficiently. Yes, we're very concerned.
So you are comfortable diverting housing funds, monies intended for housing efforts, to be diverted to other instances?
I wouldn't use the word comfortable, Mr. Chairman. No, we're not comfortable. We're not comfortable with the state reprogramming $600 million from housing to the port. We're not comfortable with it. It's an eligible activity. The state has told us that they can meet their housing needs because they over-budgeted the housing budget. We're telling them that we're not going to give them a waiver of the 50% low mod benefit on economic development. So we're holding the state accountable and responsible for ascertaining that 50% or more of those jobs created in the port do go to low and moderate income residents. So there is a misconception here that we have waived the low mod benefit in economic development. We have not, sir.
Well, Mr. Tipson has just indicated that there are significant housing issues left to be resolved in the Gulf Coast region. And what I'm trying to get is whether or not we are creating a bigger problem by diverting monies originally intended for housing for those residents of the Gulf Coast for another purpose.
Well, it was the state that determined that what they needed was $3 billion. It wasn't HUD. So we were never in a position to say to the state, we think that your housing needs are $3 billion. The state made that assessment themselves. And we said, fine, if what you want is $3 billion out of the $5+ billion that you have for housing, we agree with that. Now, the state came back to us and they asked to reprogram $600 million because their housing need is not as great. But it's not. The money is there. They just haven't spent it. So what we need is for the state of Mississippi to start spending the $2.5 billion.
So your testimony is that my state has $2.5 billion, 2.5 years after Katrina, for housing that is not spent.
That is correct, sir. They have
we cited them for that inaction?
We don't have a timeliness requirement under the supplemental appropriation like we do in the regular CDBG program, where we tell communities, if you don't spend your money in a timely fashion, we will take the money away. We don't have that under this new supplemental appropriation.
$2.5 billion sitting in the bank, and we have people living in formaldehyde-laced temporary housing facilities that could go to permanent housing facilities, is an embarrassment on everyone.
We've showed the state has disbursed of the $5 billion on the first supplemental, they have disbursed about $1.9 billion. And the majority of that money going to housing.
Mr. Chairman, I know other members are waiting, but I do want to say that formaldehyde laced was a tad strong. Formaldehyde is in all manufactured housing. Formaldehyde is in our body. What we're trying to determine is what level. I think we all agree that we need supplemental guidelines on timelines. My lands, how can it be sitting there that earns cash for the state, that these people were never intended to be in these travel trailers, regardless of whether I think they're going to get cancer from them or not. That wasn't the intent of the program. And I agree with your general consent. My big concern is that, in fact, many people live in mobile homes. Many people use travel trailers and camp with them a long period of time. We have no concrete evidence. Yes, we have evidence that sneezing and certain people are reacting in certain ways, but that's what we're studying, and you're going to panic people over that. I was just concerned about the language.
The gentleman's concerned, but we heard Dr. Falk's testimony that raises significant flags about long-term stays in travel trailer, and I'm talking about long-term stays, in this instance, somewhere over 2 years for people who should have been transitioned into other housing. And when I hear my home state of Mississippi and other members of this committee's home state of Texas, who have 2 years after money has been graciously granted by Congress, still has the money sitting in the Treasury. And that's totally unacceptable.
Mr. Chairman, I have one other comment. I know that this is kind of loose, and I apologize to the other members, but that there, in fact, are different kinds of trailers in New Orleans and elsewhere, and some are small and some are larger. I'm not defending, if you've had a home, the purpose of the United States Congress is to get you back in a home.
Sure.
But we're comparing, to some degree, some that are short-term with some that actually people live in year-round all over the country, and it isn't necessarily uniform here what's going on in these regions.
Well, and I agree, but again, I don't want our government putting people into housing that has questionable health outcomes if we know that there are some questionable health outcomes. Gentlelady from New York for 5 minutes.
Thank you very much, Mr. Chair. I just wanted to get I guess some feedback from, in particular, our panelists, Mr. Castillo, Dr. Falk, and Mr. Bregon. In sitting here, I didn't get a sense of urgency coming from your agencies. I've heard a lot of explanations for or justifications for things that just seem that are bureaucratic inefficiencies. If in fact your agencies are actually collaborating with each other around this huge issue, where's the genius that comes out of the fact that there are certain X factors that you know already, and that someone needs to be held accountable for moving these people out? Who takes charge of a situation like that? I mean, how conceivable is it that we can compound a natural disaster with a humanitarian disaster and a health crisis? Has anyone looked at it from that perspective? Because if that is the case, 2.5 years in these very specific trailers that have this specific health effect should raise a flag that created a sense of urgency that has looked at other alternatives for housing for these people. Maybe it's not the current program that you have, but maybe it is now we have to look at what other resources we have around this nation to prevent a humanitarian crisis from occurring because the setup is not in the current constructs that we have in place. That is really what concerns me. So I want to raise a couple of questions. Mr. Castillo, I understand that FEMA is providing caseworkers to residents who reside in the housing parks that are scheduled to be closed, and in order to help them find alternative long-term housing. Have you been able to evaluate this program's effectiveness and level of success? And then I want to piggyback on what my colleague, Mr. Green, had raised about the issue of health status. Because if you already have caseworkers going out, why wouldn't we attach to that a health component that looks at the health status and treatment of the children?
Where, you know, you bring up some good points, Congresswoman, and first, I have to say there is an urgency with our agency to get folks back on their feet, to get folks back into more permanent, safe, secure housing. And we have been working with our partners at CDC and HUD in the DHAP. This is something that's new. You know, the amount of people that were left homeless overnight, basically, after Hurricanes Katrina and Rita, had never been dealt with before. We're dealing with also with the issue of moving people out of...
With all due respect, just hold that thought, Mr. Castillo. It's been 2.5 years. At some point, someone has to be saying, after 6 months, this is not moving. After a year, this is not moving. Let's start with a plan B and a plan C while we proceed down this road. I know that we are quite skilled. We have the expertise and the talent to multitask in this nation. This should be the case when we're dealing with human beings. We should always be looking at, okay, perhaps this goes wrong, let's look at this. Why isn't someone saying there are other areas of this country, perhaps they don't want to go there now, but it's better than them getting sick and us potentially having the liability of cancerous growths, of abnormalities in children, because we're waiting for all these other logistics to fall into place. And we understand you guys are working, but obviously 2.5 years later, you have this health crisis looming. Why not do something different in the interim?
And I believe we have, ma'am, and done different things, and definitely done things that had never been done. But, you know, part of the problem is if we put ourselves in the place of a victim who was affected, who perhaps has their home was destroyed or partially destroyed, wants to rebuild their property, and has a travel trailer on their property. Now, the option is, and we've offered them to relocate them anywhere in the United States, and they've refused. They want to stay where their community is, where their property is, so they can supervise the reconstruction. They can stay where their kids are comfortable, where their family is, and that's part of what we're dealing with. So we're working to increase anything we can to increase the available housing market, but within our areas, I think we have thought of plan A, B, C, and D, and done that, and knowing that it's difficult for people because they don't want to leave.
Even when their health and their children's health may be compromised, you're saying that they're sitting there? Because if that's the case, then there's truly nothing we can do. But if all of these people have been made aware that their health could be compromised as a result of this, and that this is our recommendation, and they say, okay, thanks but no thanks, we'll sit here, we'll continue to inhale the formaldehyde that's causing us to be ill, that's one thing. I just don't know how much we've made the case to these folks about their situation. Mr. Chairman, I just wanted to, Madam Chair, just a response about the caseworkers and whether they would be able to get us some valuable information or urge parents to get treatment for their children.
Yes, they can, and part of this, especially the approach through HUD, that includes with the DHAP program, that includes case management, is looking at not just moving a family from a travel trailer into an apartment or an apartment into the DHAP program, is looking at ways that they can, especially for work, jobs that can be found, and addressing needs that come up when they go out there and do the case management and get to know the families.
The gentlelady's time has expired. I thank the gentlelady. Just for record information, DHAP is Disaster Housing Assistance Program, which is the bifurcated program that you were talking about, Mr. Burgon. Thank you for your patience. The gentlelady from the Virgin Islands is recognized, Mrs. Christensen.
Thank you, Madam Chair. And representing a district that has hurricanes, where my residents have been in trailers for maybe as many as 10 years. I'm very concerned about the whole issue that's before us this afternoon. I wanted to ask Mr. Bregon about the DHAP program, because you're very careful to make the distinction between the CBDG and this program. But as I read Mr. Tipson's testimony, he says that from the beginning that transition from FEMA to DHAP has been troubled. There are people who successfully entered, but HUD failed to make payments of rent on time, and they are being forced to vacate. And a case included where a woman who was renting, her landlord decided not to participate, and she's not receiving the kind of help she needs to be able to continue. Can you help us to understand what you're doing to improve on this? And I would like to get another question, and so give me a minute answer.
Okay. Yes, ma'am. With the DHAP program, we inherited a program from FEMA, and what we're saying to the landlords is, we are the housing agency of the U.S. of the U.S. government. We must ascertain that the people that are being moved under this program are being moved to safe, decent, and sanitary homes. So we're coming to some landlords, we're inspecting the units. If these units are not safe, decent,
No, I'm talking about your failure to pay rent.
No, we haven't.
People to
we haven't failed to pay rent to anyone.
On time.
We had an issue that there were landlords getting 3 and 4 checks from FEMA, and we are cleaning our books to make sure that we're not overpaying landlords. There were letters being sent out and coming back to HUD with return to sender, no address unknown. So there were checks going to landlords that did not exist. There was
what do you do when a person then is being vacated on that basis? What does HUD do for that individual?
Oh no, we work with that family to find. We have a national housing locator. We're working with over 2,400 public housing authorities in the country, and we're finding them safe, decent, and sanitary homes. So it's not just that this individual or this family is being thrown out into the street. What we're saying to the landlord is, your unit does not meet the minimum housing quality standards, so we're not going to send you a check from the federal government to house a family in a house that is infested with rodents or something like that. So we are finding places for these families in other decent, safe, and sanitary units, madam.
I want to try to get my other question in, and I'm going to ask Mr. Tipson to comment on my question, but I would just want to get my other question out, and then it can be answered. My next question is to Dr. Falk, because there have been a number of questions raised about CDC's response and the slowness of this response, the broadness of the response. And I'm wondering about the ability of CDC to respond, because I remember when there was an Office of Environmental Health, and somehow it got disbanded. I understand now it's under the Office of Global Health. And I'm concerned that maybe CDC is not, in a time when issues of what's in our air and what's in our water are critical, that CDC does not have the proper office and kind of attention and staffing to really address these issues. So, Mr. Tilson and then Dr. Fong, please.
With regard to DHAP, we certainly have seen that rent checks have been laid. In fact, the notice that I included with my written testimony indicates that the property manager did not receive her January rent. So that is a problem. It's not just the inspection requirement. There are a number of issues, and as Mr. Bregon indicated, many of them are originated with FEMA, with poor data.
Yes, and I think it's always a very important issue in terms of the quality of experienced manpower and the ability to respond. There are funds at CDC now for terrorism preparedness and emergency response that actually help support a number of the emergency response activities. So that supplements the other parts of the budget. And so that's, I think.
They may need housing, or they may not.
Global health, and I don't know how much funding CDC provides for global health, but it used to be just a small amount. Why is our environmental health office that's responsible for the United States environmental health under global health? That seems, it says to me that it's not being given the kind of focus that's needed.
I think in terms of, and it's not my specific area at CDC, but the global health programs at CDC have increased. They've particularly increased for issues surrounding HIV/AIDS, polio, malaria, largely infectious disease programs.
Which have some nexus to environmental health sometimes, but
right.
Still.
I think the environmental health portion of the global programs is probably very small. It's a very small percentage of the total.
And is there another Office of Environmental Health outside of global?
Well, there's what's called the National Center for Environmental Health, which is separate from global health, and that is the group that is responding currently.
Okay.
And as I said, it does get support from, in instances, we're getting support from FEMA to conduct these studies, but we also get support in that program from terrorism preparedness and emergency.
Are you the director of that office?
I oversee that. The director of that office is Dr. Frumkin.
Thank you, Madam.
Chair Lane's time has expired. We have the opportunity to have a second round, and I yield myself 5 minutes. I think it is important to note that there is a sense of agreement around the table with members, because we do understand that in a disaster, you have to move quickly and find the facilities that are available. That happens to be trailers. And I still think we need further testing to answer the question of Mr. Souder, who has pointed out that we live with formaldehyde. But I believe the chairman of this committee is concerned as to how the toxicity has increased in light of the living conditions of people who are disaster victims from Hurricane Katrina and Rita, whether or not where they were placed, whether or not what they're doing inside the trailer may exacerbate. And so our point is, of the overriding point of this hearing, is that we have unexpended dollars by states that were giving these dollars in an emergency condition so that people in emergencies or in a disaster could be given relief. So I'd like to put on the record that I think we have a combination of people who are to be held accountable, and this seems to beg for legislation, either deadlines or time indicators of when you need to finish the work on a disaster, meaning how you're supposed to help people who are in a disaster 3 years, Mr. Castillo, seems to be a little bit outrageous. Even as daunting as Hurricane Katrina and Rita were, we know the pitfalls that we saw in the first response. We're still living with that disaster. The conditions of New Orleans, the people displaced. We understand that there are 5,000 people that cannot be found. I frankly believe there should be an effort to find them. But I would like to just, for the record, acknowledge that the Office of General Counsel may be at fault for shortcutting CDC's research. CDC, when Dr. Rosa came up with this question about the circumstance of the formaldehyde and no response to his efforts, HUD in DHAP not looking closely and its housing dollars at how these monies were being utilized, Mr. Paragon. Even though you're right, Congress wanted to give latitude because we were in a crisis. They told you to waive everything but civil rights, Davis-Bacon environment, and fair housing, and they're right. And we thank you for conceding, in essence, because it was an emergency. But look where we are now. I'd like to give Mr. Gerber an opportunity to answer the question, because we do have a 2007 audit that says that the state of Texas has only spent $1.1 million. He's not alone. I think Mississippi has a record of failure as it relates to not spending the dollars. You said $1.9 billion, but it's 3 years later. Louisiana, I don't have their numbers, but I understand there may be some challenges there. This is not a hearing to indict individual persons or states. This is a hearing as much for Congress to understand, where did we fail? Where is the collapse? Where is the, if you will, the Achilles heel that caused us to be in this plight today? Again, I will put on the record that the governor of the state of Texas was invited. He should have been here. Frankly, I believe the governor of Mississippi should have been here, because it is the governors who called us, raising their voices, as they should, on behalf of their constituents in their states, who were impacted in a dastardly way at this disaster that was unspeakable, that we had not experienced before, where whole areas were wiped away. And so we now have a situation where we have people still living in these conditions. Would you answer this first question, then you can explain why Texas is in the plight that it is in? I understand that you will be meeting with your board to be voting on spending caps to rebuild homes in southeastern Texas. I further understand that the local Southeastern Council of Government, the COGS, are opposed to these caps. First, we don't have people in homes, and then we're talking about not providing them homes. The other point I want to make, and I'd like Mr. Castillo to speak to that, and I want to congratulate FEMA, because I think you initiated a best practices for disaster housing. You gave some grants out to a number of states so that maybe people would not have to be in trailers. My understanding is that there was a grant given to Texas, and I know that we have worked on this, but again, you might want to respond as to what the states are doing with the disaster grants you've given them to design best practices, because maybe we have a problem there, Mr. Castillo. We've given monies out for best practices, and there's been no productivity. Congress wants to help. Congress wants to help the families that were shown in the CNN expose, walking the streets of a community where they are suffering in a trailer. Can't get any relief. Mr. Gerber?
Congresswoman Jackson Lee, there's a lot in that question. I think there's a couple of things that are important to remember. Texas didn't get that first supplemental until 9 months after, well, a little less than that, 8 months after the storm hit. By the time,
what date was that, sir?
I'm sorry?
What date did you get the monies?
Storm hit September 2005, and it was May of 2006 before we were able to draw down on that first allotment of $74.5 million.
And in a couple of months, it will be 2 years.
Well, and to keep in mind, we didn't get the other 80% of the money that came to the state of Texas until just 10 months ago. But on that first pot of money, looking at 10 months, 8, 9 months from the time the storm hit, there's also another 50 inches of rain that hit the southeast coast. We weren't talking any longer about emergency repair. We were then talking about a full-scale reconstruction of most of the houses down there. And what became clear was that as we've worked through these additional issues is that we were trying to spread the money as broadly as we could, because again, working with locals and faith-based organizations and elected leaders down there, the goal was to try to spread those very limited funds as far as we could get it.
Mr. Gerber, do you have empathy for people who are living in trailers now for going on 3 years? Do you have sympathy, empathy for people living in trailers now going on 3 years, may even be 4 years?
I go down to Southeast Texas several times a month.
So you have empathy. You see their plight.
Yes, ma'am.
This is the problem that I have. We gave a legislative fix that was broad. And I know Mr. Burgon, he is a stickler for details and accountability. And I'm sure that short of his humanitarian heart, he was not happy with some of the flexibility that was given. But they conceded to it. They did it so that we could respond to the urgency of the need. What you're saying is weather compounded it. But here's my question. Why didn't the governor go back to the drawing board and say, it is now 2 years, it is 2 years and 3 months, it's 2 years and 4 months. Let's get a different plan. Let's go back to direct compensation. That means that Mrs. Jones in the trailer would have had the ability to go to her slab and do whatever she could with that amount of money because of the urgency. Why are you micromanaging disaster so that people are living in a disaster because of your inaction?
Madam Chair, Ms. Jackson-Lee, with all due respect, I mean, the folks that we're dealing with really, in many cases, they're the poorest of the poor. It's requiring intensive casework that has required a tag teaming effort of the state with locals and faith-based organizations just to reach these literally thousands and thousands of people who are in an area, a 22-county area that's the size of.
But what about the ones living in the trailers? They're conspicuously living in trailers. You could get them. They're still in trailers.
They've got priority, but the fact is that we've had to work through a very difficult maze of rules. You've had 24 different laws that and sets of regulations that we've had to that we have checklists on that you have to go through, because if we don't go through those checklists, HUD doesn't enable us to draw down those funds.
Let me quickly, since this is supposed to be problem solving, if you want to finish your sentence.
I just want to say that I think it's important to note that as we've worked through the program, I think we really have turned the corner on.
What about the spending caps? You going to the board to do a spending cap?
We knew that $40,000 was too little because of the population we were serving. We're raising it to between $60,000 and $75,000 per family. Based on
so you're raising it up or you're cutting it back?
We're raising it up because these folks cannot take on any debt. There's no ability to. We were trying to give seed money to the replacement of a home. It's clear that there's no ability.
You should be complimented for that, but why couldn't that have been 10 months ago, as opposed to that we're doing this now? The question is that we gave you the latitude, not you, the state. Obviously, you're implementing the policies of your leadership. We gave the governor of Mississippi, the governor of Louisiana, and the governor of Texas the latitude to respond to the disaster. That was our reform process in order to move these dollars quickly. And frankly, it's failed because people are still in trailers. Mr. Burgon, if I might, and Ms. Gerber, did you want to get one last, because I need to yield?
I think the Texas model is a far different beast from what has happened in Louisiana and Mississippi, and I just beg the indulgence of the committee to see the comparison. There has not been any. We've stuck to the plan, and we're rebuilding. We're not cutting checks to people, and at the end of the day, I think you'll be proud to see what we've put on the ground with none of the kinds of problems. $1.4 billion in waste. What we could have done with that money in Texas, that you've seen documented from GAO in other states, is a problem for those other states. But we don't have a program that's going to result in an addition to that kind of waste.
Let me applaud you for, again, the accountability and the intent. But it was not the intent of this Congress to have 3 years with people in trailers.
I agree.
No matter how detailed and perfect your process is, you didn't respond to urgency. Mr. Burgon, it didn't work.
Madam Chairwoman, and to the lady from New York, I don't want you to leave this hearing thinking that there's not a sense of urgency with the Department of Housing and Urban Development. We've been working with these 5 states 24/7.
What's the problem then?
Well, the problem is the way they design the programs and the way they disperse their monies. But I don't want to give you an impression that nothing is happening, that we're sitting here like the Maytag man waiting for the phone to ring. Of the $20 billion approximately that have been authorized, over $8 billion have been spent by the states. So we hear all kinds of bad stories about the lady that didn't get her voucher on time, but we're looking at 15,000 homeowners that have been assisted in Mississippi. We're looking at over 90,000 individuals in Louisiana that have gotten their monies and are rebuilding their lives. So, I mean, when we go down the line, yes, there are some bad stories, but by the same token, there's many success stories that we also have to look at. States are very concerned in many instances.
It could be done better. Is that not correct?
Absolutely.
And you know the story of the one lost lamb. We're looking for the one lost lamb because that's our responsibility. Mr. Castillo, this is my last question. I think the legislative fix should include your responsibility to track your trailers. You know they were temporary housing. The fact that people are still in your FEMA trailers in 2008, you should be held responsible for an inventory, for asking the question, why is that the case?
Why is, I'm not...
FEMA should be held responsible, and I'd ask you for your input about that, at least to be able to give you authority to ask your neighbors, HUD, the states, because you've transferred, because that's what we did. We said, well, HUD knows about housing, but they're your trailers. Your name is called when it says formaldehyde. So there should be some oversight on FEMA to ask the question why victims are still in trailers 3 years out. Don't you think?
Yes, I agree with you, Madam Chair.
And so we need a legislative fix, or can you all do that?
Well, we take it very seriously. You know, they are our responsibilities. Folks that we're providing assistance to, that we have in trailers, are a responsibility, and we do take it seriously and doing our best and doing a lot, I believe, to move them out back into more permanent housing.
I thank my colleagues for their indulgence. I yield to the gentleman from Indiana, Mr. Souder.
Thank you, and I thank the chairlady for her carefully measured statements at the beginning, because I think it's important, because it's very easy to just kind of over-dramatize formaldehyde. It's not easy to be the defender of formaldehyde today, but in fact, many substances, that's why we have a Controlled Substance Act. Almost all of illegal narcotics has good benefits inside it, and we use it in certain ways, and other times it doesn't. What we really need to look at is what is a safe level. We're not likely to be banning this substance. There isn't an alternative substance for doing this type of thing. Dr. Falk, do you know that the .04 standard, is that what's in question here, or because that was what went out in the trailers? Was it higher than .04 there? Are we going to analyze the conditions, how it got higher? Have you looked at that question at all yet?
I mean, what we are working on for when we will present the results to people is to be able to interpret what those formaldehyde levels mean in terms of the levels within their trailers. And these are levels for air that is collected in the trailers, not as a standard for manufactured housing where it's off-gassing from the particular materials that are used in the trailers. And, excuse me, there is no standard for formaldehyde levels in the trailer. What we have tried to do is present what interpretation would be offered for a range of levels. These would be in the higher range, and these are in the lower range.
What I'm trying to understand in that answer is that, so you're in effect, if I can extrapolate and tell me if I'm wrong, that if in a manufactured home it's a .04 and they use the same percentage as they're working in a trailer, are you suggesting that in transferring that relationship, I'm trying to see why you would measure the air in one and not the air in other things?
But for most of the agencies that deal with issues of formaldehyde in air, for example, for workers, NIOSH or OSHA, or for recommendations that may come from others, like to what are levels of concern. These are usually based on levels of formaldehyde in air. These are the levels you might see in urban settings or in rural settings or in homes or in outdoors. These are the levels you might see in occupational settings. And there are standards for a number of those settings, such as occupational standards, but there are not settings for standards for within the residential travel trailers.
I appreciate the detail because that helps clarify, because basically we're not proposing zero here. What we're trying to decide, because we have those standards in the workplace, we have those standards all over, what's an acceptable level of standards, and hopefully out of today's hearing you'll also see one of the questions I keep raising is I actually know people who have lived in travel trailers, that whether they be migrant workers or others in mobile home parks, that we have mobile home industry people who can't afford more often do that. We have this historically hasn't been questioned. We don't have a body of evidence that here other factors can aggravate it. It could be weather, could be stress, could be certain people react differently, and I think it's important when you do your study, looking at the total exposure of this in the United States, to be very careful how it's interpreted, and that's and that it's not likely to be a zero tolerance level that our body has formaldehyde in it, and we would die without formaldehyde in us. It's easy to kind of villainize a substance when it's the real debate here is what level of that substance puts certain people at risk and how general. And I think part of the challenge here is that many are so frustrated that people haven't been able to get back in their homes that it has exaggerated and overhyped a possibly true risk. But we've got several cross currents going in today's hearing, and that's why I asked the question about FEMA memo, is that even FEMA may have overreacted because they hear this, they hear people getting sick, they want to protect themselves. Well, then they ought to be protecting the poor just like they protect themselves. But the question was the whole thing somewhat of an overreaction? What we need is study. We need to basically understand, but we're not going to get most likely to a zero level. I also want to briefly comment, and then if the chair lady wants to give additional time, but that part of the challenge here, I've been to New Orleans multiple times, and the last time I was there, I sat through multiple briefings. It is a challenge. If you don't have jobs and then you put people in housing, how do they pay for the housing? It is a complicated interrelationship. But I don't think anybody here or any taxpayers who've put the literally billions into the region understand why people are still in trailers. You get down there, you realize it's very complicated, but some of this suggests really fundamental questions on how we deal with emergencies, because this is years out. We've never put this level of emergency funding into a project that I would be interested in knowing what are the stumbling blocks to keep you from going faster. What were all these regulations that slowed it down? I have a group from my district, the Hope Crisis Network, with Kevin Cox, who goes in, and they've gone into Mississippi, and that I helped connect.
Yield the gentleman an additional 2 minutes.
That helped connect churches, and they said from the beginning to the end, and they've been down there building houses. And in fact, many of the faith-based groups decided not to touch the government in the process because they're getting homes up. And it's really kind of discouraging to those of us who put all this dollars in to watch individuals and church people take time to go down to Mississippi to spend a week and then go down later to rebuild when we've put all this money out and we still don't see it from the government side. And that's partly the frustration you're hearing today, too. Thank the chair lady. Dr. Falk may have had an additional comment.
Dr. Falk, if you would answer the gentleman's question.
Going back to your the earlier part of your comments, what we try to say to people is that at higher levels there's a greater risk for long-term effects, at lower levels presumably a lesser effect, that the higher levels should lead to greater urgency in thinking about relocating, that if there are children, elderly, people who are sick or with asthma, that should be further reason for thinking of the urgency of relocation. So we are considering the levels. What we don't have is a formal standard to say if you're above X or Y, you're in violation of something. If you're below, you are. But we do definitely try to point out that there is a gradation of levels and that the risks increase at the higher levels. We try to put that into context for people.
I thank the gentleman. Gentleman from Texas, Mr. Green, is recognized.
Thank
you. For 5 minutes.
Thank you, Madam Chair Lady. Mr. Falk, let's talk for just a moment about Dr. DeRosa. Is that the way his name is pronounced? Is he, in fact, the director of the Division of Toxicology, or was he at some time the director of the Division of Toxicology and Environmental Medicine Agency for Toxic Substances and Disease Registry?
Yes, and that was his position as it's stated there.
Okay. As a director, I assume that that means that he was the person in charge. Is that a fair statement?
The people who worked on that ATSDR consultation were from his division. Yes.
All right. And I assume that a person in charge of the Division of Toxicology and Environmental Medicine, an agency for toxic substances, he should have some knowledge of toxic substances. Wouldn't you agree?
Yes.
All right. If this is true, and he indicates in his letter, the very first sentence, we should be very cautious about the use of the word safe in reference to formaldehyde. Do you agree with that sentence?
Yes.
He goes on to say, since it is a carcinogen. Do you agree that formaldehyde is a carcinogen?
Yes.
It is a matter of science policy that there is no safe level of exposure. Do you agree with that sentence?
It's a matter of science policy to say that even a very minute amount of a carcinogen could potentially relate to the development of cancer. I mean, the risks would vary by the degree of level.
All right, let me go on. Level, size of the person, babies might be more vulnerable than 6'8" football players. In addition to cancer, formaldehyde, this is his second paragraph, has been shown to be a reproductive developmental toxin and is a skin sensitizer, as is evidenced by the reported symptoms of the children in the trailers in Mississippi. Do you have a problem with that sentence?
I think there's no question about the skin sensitizer. I think the issue of reproductive and development toxicant, there would be many questions about that.
All right, let's go on. He indicates that overt symptoms will probably trigger sensitization in some portion to varying degrees in children. You have a problem with that sentence?
No, and I think when he says overt symptoms in people who are exposed to those higher levels that cause overt symptoms, there is a concern of developing sensitization.
Okay, now do we still have people living in trailers with formaldehyde?
Yes.
Do we have children living in trailers with formaldehyde?
Yes.
Notwithstanding this letter, we still, before I go on with that question, how long have they been in these trailers, some of them?
Well, I've been listening
to this. Is it safe to say years?
Several years.
Notwithstanding this letter, and knowing that people have already been there for years, we are still going to have children stay in trailers with formaldehyde.
We have been very explicit in the statements from CDC that we are totally behind the FEMA assertions that people should be moved out of the trailers. We don't think the travel trailers. We don't think this is the suitable long-term housing.
Let me just ask you this, doctor. When you say moved, are you saying over some prolonged period of time, or are you saying immediately?
We're saying that they should be offered that alternative immediately. Let me explain.
Well, let me ask rather than you explain.
Okay.
Should they have been moved within months?
I think that would certainly be a good option. That would be good. That would definitely be a wise idea. What we are in a difficult situation.
Doctor.
Yeah.
Do you have grandchildren?
Yes.
Would you want your grandchildren to stay in the trailer for years?
No, and I would say the same for
Anybody else's child.
grandchildren.
I understand, but sometimes we have to make these things as clear as we can. Doctor, perhaps I should go to the FEMA representative. Your position is that the kids are still in the trailer because. Why are the kids still in the trailer?
Well, the families, we have families throughout the Gulf that are still in travel trailers or in trailers.
Why are they still in the trailers?
The folks who are still in trailers, either there's a number of reasons why they're still in trailers.
Right.
Either
why? Give me the reasons.
Reasons they have it parked on their property and are waiting to rebuild their homes to get back in there. So they, instead of moving away, they stay in the trailers.
We have no other options.
Well, the options that we've offered include moving outside the area. Now, if they do have a concern and they express a concern to us that they do have a formaldehyde concern, then we give them the other options. The other options are immediately move out into a hotel or motel unless we can immediately place them in an apartment or a rental property.
Here is my concern. At some point, these children may start to show symptoms that are detrimental to their long-term being. We are sitting on a time bomb, understanding that we are, and not taking affirmative action to do something about it. You have the CDC indicating to you that a good option would be to get them out within months. You choose to let them move if they so choose to move.
If I can just
Yes,
correct you, sir, it's not that we choose to let them move. We're still moving people out. The bottom line is we're moving to get as many people out as possible. The people who bring the concerns are the ones who move to the top of the line, basically, or who have those concerns, and we've placed people in hotels and motels till we can get them more permanent housing.
Let me come over, and Madam Chair, thank you for the additional time, but I do want to go to Mr., is it Bragon? Sir, can HUD not accommodate the persons who are living in these trailers with formaldehyde? Can HUD not accommodate them?
Under the interagency agreement that we have with FEMA, it is their responsibility to move them out of the trailer, and then we take over under the DHAP program. Now, we do have a referral system, so all our clients that were either in public housing authorities or were in homeless facilities, we have taken care of our clients. The FEMA individuals are mostly homeowners or renters that are still either rehabbing their homes, as Mr. Castillo indicated, or still looking for units. We have been working with this universe and giving them the referrals as to what's available. In many instances, the market has been saturated to a point where there's no available units in that market, and that's why Mr. Castillo indicates that in many instances, we're telling families, you cannot stay in this town, but there's facilities in the town down the road, and they say, well, you know, my job is here, why would I move to another town?
But don't we have a duty, sir, to say to persons when they say this, look, we will not allow you to stay in this trailer. We will not allow you to stay in this trailer. You must move out of this trailer. Here are all of the options, the universe of options available, but you can't stay in this trailer because Dr. DeRosa has given us fairly good indications that this can be detrimental to your health. Probably there are a lot of other folk who would agree with him.
We don't have the authority. HUD does not have the authority to tell folks because they're not HUD clients, they're FEMA clients.
So FEMA passes it to HUD, and HUD passes it to FEMA.
No, we're not passing it to FEMA, sir. What we're telling you is that the agreement that we have with FEMA is, and that is the agreement, you move them out of the trailer, and then we'll take over. If the agreement would have been HUD, you move them out of the trailers, then we would have done that. But those, you know, that's not my office that administers that program between FEMA and HUD, but it's my understanding is that that is the agreement that was executed, and that's what they're working on.
Somebody should suffer. Some heads really should roll for allowing this to go on and on and on. There comes a time when somebody has to step up and provide some leadership. And if the agreement is inadequate, if it doesn't provide what you need, then you should give someone the opportunity to help you amend it. Children should not continue to stay in these trailers. There's something dastardly about this. It's sinful.
I agree with you, Mr. Green. And remember, this agreement was just signed December 2007. So this had been going on under FEMA for a long time before HUD got involved. HUD secretary told this body, we are willing to take on this responsibility if you give us the resources. And that decision was made on December 2007, where approximately $380 million were transferred to HUD to do this undertaking. So we are doing what we're supposed to do.
Gentleman's
and
time.
I agree with you. I mean, this is
has
it's
expired.
a travesty.
It is. Thank you, Madam Chair, and thank you for that comment.
Well, Mr. Green, I think you allowed Mr. Bergon to capture the essence of this hearing. It is a travesty. And I'd like to join my colleagues on this committee and reaching out to the other jurisdictional committees to fix a completely broken, disaster response. I yield to the distinguished gentlelady from New York for 5 minutes. Thank you, Mr. Green.
Madam Chair, I think that, you know, this hearing has really highlighted some real heavy lifting that has to be done by our government to really make whole the people of this region who seem to be just stuck right now. And I just hope that the representatives here will take what has been said, what they've heard, and really try to get some traction done in their respective agencies, because clearly I don't think any of us would want to be in the same predicament as these folks are who are living in these trailers right now, knowing what we know, knowing how long they've been there. There has to be a solution. I know that, again, the talent, the expertise, the ability exists within, you know, the individuals who are here within their respective agencies to get this done. I think that the will has to supersede everything else at this point to just make it happen. I'd just like to say that in closing, Madam Chair.
I thank the gentlelady for her insight, and certainly and I will yield to the gentleman from Indiana, as a member from New York, you know disaster. And it seems that although all is not completely well with New York, we do know that Congress moved quickly in order to help those victims. What is the breach that we have here with Hurricane Katrina and Rita? Before I close, and I thank the gentlelady, is she yielding back? The gentlelady yield back?
Madam Chair, you back the balance of my time.
Okay. Let me, Ms. Souter, yield to the gentleman.
I just wanted to ask Dr. Falk a question, because a lot of life is managing risk, and nobody wants high risk. But aren't there carcinogens if I go eat fast food at McDonald's?
No, there are carcinogens in multiple parts of society. You're absolutely right, and we try to evaluate those risks and deal with the untoward risks and reduce the high risks. And
isn't there in broccoli and natural food as well?
There probably are carcinogens in foods.
And as we look at cell phones and microwaves, we've talked about what comes off potentially. Life is managing risk. What we want to make sure is that we don't put people who are vulnerable in high-risk situations ever, and we certainly don't keep them there a long time. But we have to have a balanced view here about risk, and it's fine to say I'm not going to have any carcinogens in my body, but that's really probably not realistic even in this room. Certainly secondhand smoke, however, puts it up to a different level, and that's what life is debating.
And when we try to speak to people about formaldehyde levels, we will look, say, at a range from very low, maybe close 0, all the way to 1,000 parts per billion or 1 part per million and above, and try to emphasize the risks are greater at the higher levels, the risk for sensitization, the potential long-term risk for cancer, the risk for acute effects, and emphasize the urgency related to seeking alternative housing at the higher levels.
Thank you.
Let me thank the gentleman from Indiana and the gentleman from is yielded additional minute for a question.
Doctor, I just want to make sure that
Gentleman from Texas, Mr. Green, is recognized.
Thank you, Madam Chair. I want to make sure that I understand you. You're saying that a child eating a hamburger at McDonald's is exposed to the same level of carcinogen as a child in one of these trailers?
No, I didn't say the same level, and
But that's the implication from the way you allowed that to be explained. Doctor, listen, this is really serious. Let's not play with lives by talking about McDonald's hamburgers versus formaldehyde in trailers. Now, you are a man of science. You're an honorable man. Don't allow your record to reflect that kind of insensitivity. This is your watch, doctor. You ought to be concerned. Don't let that happen on your watch.
Yes, and we are concerned, and I apologize if I left that impression.
Thank you, doctor.
Let me thank the gentleman. Let me finish with two quick questions. I think we have just framed the dilemma. There's an agreement. An agreement that pushes one aspect onto FEMA and another aspect onto HUD. I would ask for the agreement to be submitted to this committee, and I would, if there are any other attending documents, I would ask that those come in as well. Let me quickly go to Mr. Castillo to now ask you to provide this committee with a report under the agreement as to the conditions and the presence of people, I'll go so far to indicate Mississippi, Louisiana, and Texas that are in trailers, that are your trailers, that come under the agreement that Mr. Bergone referred to. Meaning that Mr. Bergone has indicated there's an agreement, you're supposed to get them out of the trailers and they go to him. Tell us who's left in the FEMA trailers in Texas, Mississippi, and Louisiana, because that frames the Department of Homeland Security's responsibility in disaster.
Just for clarification, you mean the numbers of folks still in trailers?
Yes, sir.
Yes, okay.
All right, and you might, if you have the census ability, meaning the capability to decipher seniors and children. I know there are others in the mix, so if you would do that. Then would you please tell me the status of your disaster best practices grants? And you understand what I'm saying? When you gave dollars for people to design something other than a trailer, did that not happen?
The alternative housing pilot program?
Yes.
Yes, ma'am.
And do you have anyone who has completed what they're supposed to be doing?
Not completed, not completely, but there has been.
And how long ago did you give that grant?
Well, if I can, Mississippi has already installed 1,346 units.
This is under their grant?
Correct.
When did they get the grant?
Don't know exactly the.
How many for Texas?
I'm sorry. Texas was recently signed. There's no units in place yet.
And you will give me a full explanation in writing of why it was recently signed. Do you know when the grant was rendered?
Yes, I will provide all of that in the status.
I would appreciate it. So my question will be is that you'll give us an inventory. And I do want to acknowledge how responsive Director Paulson has been and FEMA has been. I think it's important to put that on the record. And I know that this is a difficult set of inquiry. I would like also to ask of FEMA to get a report to you of how much longer these persons will be in the trailer. And the reason why I ask you that, because in essence, you have jurisdiction over them to date. All right? Mr. Gerber, you are a recipient, the state of Texas, of these dollars. You have opted, as opposed to a compensation program, you've opted, I assume, to a rehab and construction program. And my question to you is to provide us, this committee, with immediate benchmarks, immediate scheduling of when you expect to move the large numbers of individuals out of trailers and when you expect for construction to begin. The Saunders families may be an example. Those who are still in trailers, I'm going to focus on the trailers in Southeast Texas. When you expect and what the process will be to begin construction as soon as possible. Is that possible to do?
Yes, ma'am, we can. Again, keeping in mind that the process is really on a first-come, first-served basis. Folks with trailers are certainly getting priority, but there's 70,000 other properties potentially that could be eligible for those funds, of which we expect we'll probably wind up serving.
But if you made progress on those in trailers, you would be responding not only to those others, because as the trailer people move, you're able to go to the others. You understand what I'm saying? As you move those people.
I'll submit a written.
My last point to you is, what can we do to help you?
Fair. Would you like me to submit that in writing, or would you like me to answer?
If you just quickly, and then put the rest in writing.
You know, I think what the hearing has shown is that there's just a gap between where first response leaves off and where the longer term, and who's really responsible for that second response. HUD, and not wanting to represent HUD, but HUD, much like us, we're a financing agency. We help to build affordable housing throughout the country. We're not, in the case of Texas, we're not necessarily a tool to be a disaster recovery agency. If we are, and that's the desire of Congress, and there's a program and funds associated with it, I think that there's probably some middle role to be played. But I think it's fair to say that the Community Development Block Grant Program is a program that communities use with great effectiveness when they have a long period of time to do some planning. Works great for that. Sometimes it doesn't work so well in the disaster recovery arena.
I think you have given us, and if you could expand on that in writing, but I think you have given us a very good response. And I close on, Dr. Falk, would you concede that the time in the trailers contributes to the problem for children and seniors and people with respiratory illnesses, and that 3 years contributes to the detriment of individuals being in trailers that might have formaldehyde?
Answer is yes, and as I said before, we've stated very firmly that it really is time for people to receive alternative housing.
Let me thank everyone for their presence here today, and thank all the witnesses. You have extended yourself in terms of sharing with us. I don't think, and I will not hold this meeting to be an informational meeting. I'd like to thank Chairman Thompson and Ranking Member King, Mr. Souder. This is not an informational meeting. This is a meeting to point out the dilemma of thousands who are living in trailers and that we have a crisis. Mr. Gerber is articulate and committed. He made a point. I believe that the CBDG dollars was the wrong vehicle. I think the monies were helpful, but I think the governor should have worked through the enforcement of Congress for a disaster-type agency that had the elements of housing, Red Cross, social service, that was plugged in to address the question of urgency. For example, maybe they would have retained a builder that would go in and begin to build as quickly as possible a form of housing that could substitute for the trailer. None of this was done. I think we have a breach with FEMA not continuing to monitor and to assess those disaster victims in their trailers, and to inventory those individuals and to monitor where they are. And I think you also need to find the 5,000 people that are missing for whatever reason it is. This is a hearing to fix us better, to make us better than we were, and to be able to respond to the disasters that come upon us every single day. I look forward to this committee addressing this question legislatively, and I thank all of you for your presence here today. This meeting is now adjourned.